Welcome to Shanu's Media Education. Please do subscribe for my YouTube channel Shanu's Media Education for more videos. Today I am going to take the therapeutic procedure of the O2 therapy. Nowadays it is very commonly we are using for that O2 therapy. For whom we are using for the O2 therapy, who are the required for the oxygen level, who cannot maintaining themselves to the oxygen to the patient, so we can provide the O2 therapy. And how can we provide the O2 therapy? Please watch till the end so you can understand the oxygen therapy, how can we provide that patient, and to whom we provide the patient, you can understand. So please watch till end. Yeah, my name is Nagesh. I'm a psychiatric lecturer, News Media Education. The description of the procedure: the administration of the supplemental O2 to treat the hypoxia. What is the hypoxia? The hypoxia means the oxygen level in the body. We cannot maintain the oxygen level, so that hypoxia will go the patient. So that we administer and adjust the O2 required to the prescription of the patient. The indications of the hypoxia. The hypoxia, the early indications are the tachypnea and tachycardia and restlessness and anxiety and confusion and polar elevated blood pressure and use unnecessary muscles, nasal fragging and adventures of the lungs. The late indications of the hypoxia, the stupor and cyanosis and bradypnea and bradycardia and hypotension and cardiac disease arrhythmias will be occurs. The nursing interventions, the pre and intra and post. The pre-nursing intervention should be the follow the monitor respiratory rate and the pattern of the patient taking the oxygen level and loss of consciousness and saturation SpO2 levels and ABG. So this is the most important intervention for as a nurse. We should follow this before administering the oxygen level. So we know how we will know the oxygen level is low through the monitoring oxygen level along patient loss of consciousness and breathing sound. Along with that, we should confirm with the ABG. Sometimes the ventilator patient, how will we know oxygen level or maintaining or in monitor that maintaining that oxygen, but in the body of the blood that will be not maintaining. So that should the monitor the patient oxygen level in the body. So the pre intervention should be followed. Then the intra intervention, if the ABG is very low and saturation level is very low, patient is loss of consciousness, will be go. So that we should provide the oxygen therapy at the lowest liter flow that will be correct the hypoxia patient. We should start with the lowest filter. As well as we know the patient how he is maintaining or how much will be required for that. Mostly the experienced nurse will know the how to give the oxygen, so that whatever needed we should give that oxygen level to the patient in intra interventions. Then after the administrating the oxygen level to oscillate the lungs for the breath sound and adventurous of the sounds of the patient, and encourage the patient to turning and cogging and deep breathing. Why we should encourage the patient and cogging deep? Like, it will be help for the patient lung will be free, so the patient may come capacity to take own breath and own oxygen level he will maintain. So that this is the main interventions of the nursing after the administrating the oxygen level. The outcome and elevations. The outcome after the administrating the oxygen level, first we need to monitor the oxygen saturation. So why we should monitor the oxygen saturation? The patient is maintaining or not. If it is he maintaining, we should increase the oxygen level. If he will maintaining, for example we are giving 2 liters of the or 3 liters of the oxygen, so patient is not maintaining, so we can increase the oxygen level. For 3 liters the patient is maintaining, so that we decrease to 2 liters. So the patient will lungs will not affected more. So the monitor the patient CO2 level. The CO2 level is very high when is a patient will be go hypoxia. So that we should monitor the CO2 level. How we will monitor? Through the ABG we can monitor. That is the only option for us to the patient monitor the oxygen CO2 level in the body. The client education. Teach the patient to use the incentive spirometer. For hypoxia patient, maybe the lungs will be affected. So that will be, he will go for the hypoxia. The spirometry will be increase the patient lung capacity and to self self intaking of the oxygen level, so that it will be very useful. And teach the patient to the breathe deep while eating the or eat smell to meal more and frequently. Teach this deep breath while eating, so the patient hypoxia patient may have low oxygen level in the body. So when he will taking the food, that time he will be maybe aspirate, so that will encourage the patient to take the deep breath while the eating, so that it will be not go the patient again in hypoxia. So this is very useful technique for the patient and nurse also. Potential complex oxygen toxicity. What is oxygen toxicity? Sometimes the hypoxia patient, the newly someone there is don't know how to give the oxygen to the patient. What they will do? They will the patient will go hypoxia. They will what they will do? They can give the more oxygen supply to the patient. If patient he is required for 2 liters only, but he is he is giving for 10 liters. So some that time the patient will be maybe go for oxygen toxicity, that are non-productive fog and sub terminal patients and nausea and vomiting and fatigue. That dyspnea also occurs in when is the oxygen toxicity. The patient may be restless. The normal patient also will be go restlessness, and paresthesia also will be occur. The induced oxygen hyperventilations also, sometimes patient may be go for ventilation support also, we will be go to the patient. So after oxygen toxicity, the nursing interventions, so what we will do for that, use the lowest level oxygen necessary and maintain the adequate SpO2 level to the patient. The oxygen toxicity may sometimes will be occur. They don't know how to give the patient and how to provide the oxygen to the patient. So that sometimes adequate saturation level may monitor ABG and notify the provider to the SpO2 level or outcome the expected reference range. Though when we are came to know that oxygen toxicity will be occur, first we need to check the ABG, so that we should know that the oxygen level is high, so it will be going to oxygen toxicity. So that we should notify the provider. Who is the provider? The doctor is the home provider. So that we should inform to the doctor, and the oxygen levels are in high to the expected level reference range. So what I should do? The doctor will may suggest decrease the oxygen level to the client SpO2 will be maintained. So the oxygen, how to reduce the oxygen toxicity? So we should decrease the FiO2 oxygen levels, that is 5 liters to 2 liters, so that the patient will may improve the oxygen own capacity, and the toxicity maybe not we will be occurs. So thank you. This video will be useful for you. So please do subscribe my YouTube channel, and thank you for watching. For more latest videos you should subscribe my YouTube channel. I will